Welcome back to Mid Morning. Addiction Recovery Care is working to prevent opioid overdoses. Narcan, or naloxone, is a life-saving drug that can help reverse the symptoms.
Here to tell us more about it and show us how to administer Narcan is Jason Merrick. Jason, thank you so much for being here with us today. Now, we've been hearing a lot more about Narcan. Tell us how it works.
Thanks, Destiny. So Narcan is a non-narcotic. It acts as it reverses the effects of an opioid overdose. So it removes the opioids from the receptor in the brain and it restores breathing. So it can save a life in the event of a crisis situation.
And are you all wanting to encourage more people to carry it, just in case they see something like that?
We do. So Narcan is widely available and it's very safe. It's non-toxic. So it's safe for women, safe for children, safe for elderly, it's safe for anybody.
What are the signs and symptoms of an opioid overdose?
Some of the signs and symptoms, that's a great question. So you'll see somebody who's very lethargic. They could be have like a gurgling sound, a raspy breathing. They could be completely unconscious, or they could be just looking like they're sleeping. You could also see some signs of poor circulation, like discoloration of their lips or of their fingernails. In light-skinned folks, you could see like a blue or purplish, and then in dark-skinned people, it would be more like an ashen skin tone. But overall, you can obviously tell they're in crisis and they need help, urgent help right away. So
if you have a Narcan like this, how would you go about giving that to someone?
Sure. So you'd want to place somebody on their back, right? So they'd want to be laying down. You want to make sure that there's nothing in their airway, right? So nothing would block them from breathing. You want to see if they can respond, right? So you would do like a sternum rub where you could rock your knuckles back and forth on their sternum. That would produce a stimulation, a painful stimulation. It wouldn't hurt them, but if they're able to respond to that, they would. If they don't respond, you can determine that they are unresponsive and that we need to do 4 simple steps in responding to an opioid overdose. First is you want to call 911. You got to get help on the way. Okay, they need it to be under medical observation for several hours after this medicine has been administered. Secondly, you want to perform rescue breathing or CPR based on your level of training. But that's where you would give 1 rescue breath every 5 seconds for 30 seconds, and that replenishes the oxygen in the bloodstream so they can survive the overdose just at the time that it takes for that Narcan to get into the bloodstream and into the body where it needs to go. And then after the rescue breaths or CPR, you would want to open up your Narcan device. It's in these little blister packs. There's instructions in the pack. There's also instructions on the box. Then you would take this device. It fits very easily between your fingers and your thumb, just like this. And you would insert this up a nostril, and you would press the plunger. And it comes out in a fine mist. It's absorbed into the capillaries that are in the nasal cavity, and it goes right where it needs to go, in the bloodstream. They don't even have to be breathing for this to work. It goes right into the bloodstream through those tiny blood vessels in the nose. To be absorbed. And it comes out in a fine mist, just like this.
Okay.
Right? So it goes right in there. You don't want to do part up one nostril, part up the other. It's all one dose up one side. And then the last step is that you stay with this person until help arrives. And you continue with rescue breathing or CPR until help gets there. And each box has 2 doses in it. So you might need to give another dose to restore the breathing, or if they were to go back into overdose before help gets there, you have another dose.
You can save their life. Thank you so much for being here with us today.
Oh, you're welcome. It's my pleasure.
Great information.
Thank you.